Sabanang logo ye chawsan bunu county nabo naroka kecha kinige county nabo nande laga masi si nabo tililinda ensregali nabo county nabo nande Angeline chip chir kiroya kole ke beberta nabo tamon wagik sit ang moten bogola en bike chinga go nyoy sit ko gigo noyo akoi sit ap kri chega chenge chegen ka main ko tigonit ka bun ko nyoyga en kasratan go goni nego teuniet ko timengi ke bai sen kri che ke ba imbara ko manyor go tigonit ka bun ko nyoyga kole an magat ko gergo legay muj kruto chike tesosi ke chabo tililinda Potinge ang noten komagain ine membay kapkot naging otin ngotu chukotoy ngotu tiketorete keregunin kerichik etana chepchin ngemet kip ko sabe asikabit keregunin asinet nebu myanwage chebu baysit na bagrichi kingeme chametap kiyam kapit neton enkasta nebu atingoy ngomogola wigit noten ba global antimicrobial awareness wika nikisuldoen ko ngeten tarigi tamanaksit agoy tarigi tupteme agangwana rawet na batamanage en kila kanyit agachogola.
It's becoming more expensive to treat simple infections like pneumonia today because we are forced to use very expensive drugs because the drugs that used to cure them easily, the disease do not respond to the same. And this has come out because of our behavior. And we are calling on everybody to take responsibility so that we can reverse the trends. In our homes, we have animals. If we treat animals, let's also know how we handle the treatment and the disposal of the byproducts or, the bottles, ensure that we bury them deep. This is what we used to practice earlier. But then in the recent past, there's a lot of wastes that are scattered all over on the services. So this is a clarion call. Sooner than later, we will be handicapped without medications that can help us to cure diseases, unless we go back to the roots. Let's take responsibility as citizens, the way the Constitution gives us responsibility.
That whenever you're given prescriptions, kindly adhere to the dosage and avoid self-medication. As of now, UHC is free. PHC services are offered freely in all our facilities, so there is no justification why you should do self-medication. Kindly adhere to the dosage and complete the dosage as given so that we do not encounter antimicrobial resistance. The second thing is to our clinicians, let us continue adhering to our standard of operating procedures such that we give out antibiotics based on first line, second line and the likes. Let us adhere to our standard operating procedures to avoid any antimicrobial resistance. Operating procedures to avoid any